From the Milton H. Johnson Health Center at Chipola College in Marianna, Florida, the Florida Education Channel, in a partnership with the Panhandle Area Educational Consortium's Risk Management Team, brings you Hot Topics in Sports Injury Prevention. How will coaches know when a player needs immediate medical attention? What are some of the warning signs that an athlete may have suffered a concussion? How will coaches know that a player is ready to play? What can I do as a coach to help prevent these injuries? These and many other questions are answered by prominent medical experts in the field of sports medicine as they present to a group of 120 middle and high school coaches in all areas of athletics to gain knowledge and insight in preventing sports injuries.
Thank you very much, and Dr. VanLandingham. Thank you, sir.
I wasn't playing football, but I did have a concussion playing football. I was moving my brother down to medical school at that dirty town of Gainesville, and we had dinner one night, and we had a bunch of our friends together, and I was the last person to walk out of the restaurant, and there was a vagrant who attacked me, and I hit my head on the curb, and I ruptured 3 blood vessels in my brain, and I was in intensive care for quite a while. I had amnesia for almost 18 months, and I lost my sense of smell, headaches, all the kind of stuff that went along with it. But I was still able to hang in there. My mom used to drop me off at school. Sometimes my grandma would. When I was in college, she would drop me off at the university, and I was in physical therapy school at the time. And when I would take a test, I would be like, I'd have to read things over and over and over and over again because I couldn't hardly remember from 5 minutes ago. But I was able to get through PT school, and when I got out of PT school, I worked in inpatient rehab with traumatic brain injured stroke patients, and then came back to Tallahassee and worked with neurologically impaired children at the Dick Hauser Center, which, by the way, is a great place. And anyway, so it went back to get my Ph.D. and focus my Ph.D. work on traumatic brain injury, and then was lucky enough to get an opportunity to go up to Emory University and postdoc with a guy who actually started the PROTECT clinical trial, which is the only current clinical trial for traumatic brain injury in the world. So it's close to my heart. I'm going to actually steal a little time and talk to you a little bit about research and as it's related to head injury. There's going to be some slides that are going to talk about some various forms of head injury, one of which is concussion. You may hear me say concussion is mild traumatic brain injury. We'll also talk briefly about more severe head injuries that can occur, and also a brief sort of overview of blast injury too as it relates to our veterans. Who here has always heard that you stop growing when you're 18, right? Your bones, somewhere around the time of 18, your bones stop growing and you're as tall as you're going to be, right? Well, it kind of goes the same for the brain. The brain really continues to develop until the age of 18, and that development is from the standpoint of what is called myelination. So the myelin is the sheath or the covering around your nerves that are in your brain, and that sheath allows you to run quick signals and have good attention and good memory and good information processing speed. One of the major things that happens with a head injury, including a concussion, is you have a temporary state of demyelination where that myelin is, not properly functioning. Well, if you've got a kid under the age of 18 that has a concussion and they haven't fully formed myelin, when you damage that myelin, it's even harder for them to get back to where they were. So anybody under the age of 18 is going to have a much more difficult time dealing with a concussion than an individual who's older than that, if that makes sense. I promised Rick I wouldn't be too scientific today. So anyway, to reiterate, with regards to brain injury, there's about 1.7 million brain injuries in the United States each year. 1.2 of those are mild, which are concussion. But about 2.5 mild brain injuries or concussions go unreported and untreated every year. That's not good. If we're not reporting a concussion, well, then we don't know when it's okay to return to play. Then they get a second concussion, And then we're leading them down a road known as second impact syndrome. Second impact syndrome is when we have repetitive concussions on top of each other that can lead to chronic traumatic encephalopathy, which is what you're reading about in these football players. It often looks like, with age, what an Alzheimer's disease brain looks like. From a morphological and from a molecular standpoint, the brain of one of these football players, who, like Dave Dewerson, is going to look very similar to that of a patient who has Alzheimer's disease. And some of the symptoms are going to be the same. One of the hallmarks of brain injury is memory loss. Memory loss often goes hand in hand with attention loss. So you have to pay attention to remember stuff, and to remember stuff you have to give it attention. So in a way, memory and attention are kind of one and the same. They're first cousins, if you will. Then you're also looking at a loss in processing speed. And that goes along with your concussed athlete who comes in and maybe they're not doing as well in school, they can't remember things as well. They also, when they do remember it, it takes them longer to remember it. That's that slowness and processing speed that goes along with a concussion. Anyway, so let's march on. I wanted to mention briefly about our veterans and blast injury because I want to relate the different injury processes. But there's about 360,000 predicted head injuries from blast that are occurring between Iraq and Afghanistan. Of that, about 15% of our veterans population is going to come back and be what is considered the miserable minority. What does the miserable minority mean? The miserable minority is that set of people who sustain concussions that are left with post-concussion syndrome. So most people get over concussions, but about 15% of the population, including athletes who have had a concussion, will be part of this miserable minority. They will have post-concussion syndrome. So I'll briefly take a minute to tell you what post-concussion syndrome means. If you've ever heard of the DSM-4, well, the DSM-4 states that a post-concussion syndrome is an individual who has symptoms of concussion, memory loss, attention, processing speed difficulties, maybe headaches, insomnia. All these symptoms must have persisted for at least 3 months. So if you've still got symptoms of concussion after 3 months, you are technically a patient with post-concussion syndrome. And we're looking at possibly 15% of our athletes or our veterans who have had concussion that will end up with post-concussion syndrome. So we want to avoid post-concussion syndrome, right? We want to avoid any of the negative things that go along with a concussion. In general, there's 2 ways to do that. You can do research to find a prophylactic, or something that prevents it or reduces the sequelae that may follow, which is one of the things that my laboratory works on. And you can also look at treatments that are acute. The major issues or the cascade of negative events that go on in the brain are going to occur in that first 24 to 72 hours, okay? So we've basically got about 72 hours to have what I would consider an acute treatment for a concussion or head injury that would have a positive effect on the outcome of that individual. After 72 hours, there's not much we can do treatment-wise from a pharmacological standpoint, if you will, that would benefit that patient. After that point, we're looking at new options for rehabilitation. Most of the time, if they're not part of the 15% that get post-concussion syndrome, you give them some bed rest, some fluids, you keep them away from aerobic exercise, make sure they don't fall down because balance loss goes along with concussion. And, you know, you wait it out, and after a couple of weeks, they're probably playing football again, or basketball, or horse riding, or whatever. But we do need to continue to look for rehab opportunities for that 15% of patients who did not get treated acutely, didn't have an option for repair early on of the brain, and end up with post-concussion syndrome. So I'll talk briefly towards the end about some new rehabilitation techniques for post-concussion syndrome. So let me tell you a little bit about the concussion or the head injury models that we do in my lab at the College of Medicine at Florida State. We have a controlled cortical impact model, and this is to create a moderate to severe brain injury. So this is the individual who comes into the emergency room after a major car accident and is in a coma. And we're looking at ways to treat them in an acute setting for their brain injury. I will tell you, I'm going to mention a drug in a minute that is in clinical trials. It's in phase 3, phase 4 clinical trials for the acute care of severe to moderate head injury. And that clinical trial is actually now ongoing at Tallahassee Memorial Healthcare. And Dr. Romana has been key in getting that clinical trial here in Tallahassee in our area. The other model I have is a concussion, which I'll show you some cool data about prophylactic treatments for concussion. And then we have a blast injury model, but I won't totally bore you with that. So we do a lot of our imaging and to detect what's going on after head injury at the magnet lab at Florida State University. We're lucky enough to have our hands on the largest magnet in the world, which is a 21 Tesla magnet. And we can do sodium diffusion imaging, which you see on the top, which can show the amount of edema that occurs or swelling that occurs in the brain after an injury. And then we have on the bottom the capabilities in animals to do diffusion tensor imaging. Diffusion tensor imaging is really probably more key for you guys to understand its availability, which is limited. But diffusion tensor imaging is tractography. What that means is that the neurons are tracks, and it can tell if the tracks of the neurons has been damaged. Diffusion tensor imaging is the only imaging capacity to tell if you've had a concussion. It is not foolproof, but it is around 65 to 70% of a hit rate if an individual has had concussion. They will show pathology when we evaluate them with diffusion tensor imaging. That is available in Atlanta and Tampa. We hope one day it will be available in Tallahassee as well. But right now we don't have that opportunity. So the candidates for drugs that we study in my lab, you can see the list there: progesterone, allopregnanolone, TRH, vitamin D, zinc, and we do stem cell therapy too to try to repair the brain after injury. Some of these drugs, primarily progesterone and vitamin D and zinc, are actually being evaluated now in a concussion. So progesterone, I want to mention this because this is indeed the drug that is in clinical trials, phase 3, phase 4 at Tallahassee Memorial Healthcare. Progesterone, everybody thinks, is a female hormone, right? That's wrong. Progesterone is actually produced by men and women. And in fact, there's just as many receptors to progesterone in the brain of a man as there is of a woman. In fact, the brain can make its own progesterone equivalently in a man or a woman. So what we were first able to identify is that in women, if you look at the red bar up here, female animals that were in proestrus, where they had high levels of progesterone, actually had a reduction, as you see, in swelling in the brain compared to their male counterparts. That was the key. We were just hitting males and females on the head, thought there was no different. And it turns out when progesterone was high, the swelling in the brain of the females was less. That's all it takes, is a finding like that. Now we're in the end of a clinical trial that will have over 2,000 patients enlisted, and hopefully one day progesterone will be standard of care in the emergency room for brain injury. This will give you an idea of what a rat brain looks like when you slice through it. If you look at top, you can see those big gaping holes in the top on both sides. That's the area where the brain has been damaged. The other cool thing that we're doing now with stem cells is we're able to take a stem cell and actually make it where it will produce a lot of a neurotrophic factor. So not only are we putting stem cells into the area where the brain has been damaged, but we're putting that cell in with the ability to express neurotrophic factors and help the cells that are still there to continue to survive. So we've got a lot of cool stuff that we do with stem cells. The clinical trial that led to progesterone being now at TMH was known as PROTECT. You may also hear out in the literature the term SYNAPSE. SYNAPSE is the sort of the severe version of PROTECT. PROTECT actually uses progesterone for moderate and severe brain injured patients. where Synapse, which is technically the one that we're doing at TMH, is using it just for severe brain injury. So Protect was taking patients in the Atlanta area, mainly from car wrecks. We did have some older folks who had fallen and hit their head, and occasionally we had a weird circumstance. But for the most part, it was severe to moderate head injury from car accidents. And we were able to show that indeed there was a 55% reduction in mortality in patients that received progesterone for head injury within a 72-hour period of the head injury. Now I'll move on from my cool progesterone study and talk to you guys a little bit more about why they brought me here. And this is to fill in for Davy's part as in regards to concussion and to impact. So I think that Dr. Romana and some others have covered, removing the athlete from play, having a healthcare professional evaluate the athlete, making sure that the parents or guardians are informed. And a lot of this, I think, is what's going into the legislation, as we heard from Frazier earlier. And the main goal, and for me to remind you guys, is to prevent second impact syndrome. I mean, one concussion, you're usually going to be fine. But if you have a concussion, you're more likely to have a second one on top of it. And at that point, you're entering into the repetitive concussion realm, which is second impact syndrome and can have long-term consequences, including early death. So we don't want them to get back in too quick and get another knock on the noggin. You guys remember Tim Tebow, I'm sure. He was pretty good, but he underwent this impact, this neuropsychological study baseline before the season. Most of the SEC teams and a good portion of the ACC teams do indeed have impact in. And this is my opportunity to tell you about how we were able to get impact into the Leon County schools. So the general idea is to put this program onto the school computers, let them get a neuropsychological baseline for attention, visual, spatial, memory, and all these different psycho-babble that we could talk about all day. In that way that they've got to get back to baseline before they play again. Tim Tebow had to get back to baseline before he could play again. So a couple years ago, my partner in crime and lovely date, Cherie Porter, and I had this idea that we were going to try to get neuropsych testing in the high schools to prevent concussion. So we went up to Ricky Bell's office, who is the athletic director for Leon County, and TOC folks, Martin and Andy Wong and Davey Young, had beaten us there. They too had the same idea. So that allowed Cherie's group at TMH, my group at the FSU College of Medicine, and TOC to join together to provide impact for the Leon County area. This year, hopefully, I'm going to be able to help out some with the funding, and we're going to continue to push for more funds so we can widen our area of these schools that can get impact testing. In fact, we want all sports. In fact, I think that Martin and Andy's and Davey's job this year, our goal is to actually get all sports tested for impact. Girls soccer, boys lacrosse, whatever it may be, everybody has a baseline, and if they get knocked on the head, they got to get back to baseline before they get to play again. So last year alone, we did 970 tests. 970 players in Leon County got impact testing. Of those 970, we had 91 incidents of knocks on the head that had to be reevaluated. So that's almost 10%. We do all the public high schools in Leon County, including Florida High, McClay, and FAMU. And we have done recently some studies with the girls softball team. In fact, we have 2 of the tests of those 91 that had to get retested came from girls softball. Anyway, that's to give you an idea. It's what, about $300 per school? I think it's about $300 per school to implement this program. And it gives you a baseline, and it gives you something to stand on before you return that individual, that young individual, to play. I'll tell you a little bit about some research that we're trying to use to further empower impact, and that is a blood biomarker study. in conjunction with TOC and the athletic trainers and their coordination with the Neuroscience Center at TMH, which, by the way, we've made concussion cards, which you guys should check out. They go in your wallet. They're out front, and it actually tells you how to test an athlete, what to look for in an athlete on the sidelines. So make sure you pick up a concussion card. You can always say, okay, something may be wrong with him. Let me remember what I need to ask him. And we've got some examples of what you want to ask and what you want to look for. So be sure to pick up a card. But what we're doing this coming year is to try to empower our results from impact, as we're actually going to draw blood from individuals who come in for concussion and actually look at some of the more up-to-date blood biomarkers that reflect brain injury. Anytime you have a brain injury, be it mild or severe, the barrier around the brain that keeps the brain separate from the blood is damaged. This allows stuff that's normally in the brain to actually fall out of the brain into the blood, and you can identify it now in the blood. Our goal is to identify the severity of an individual's blood with regards to the brain injury and correlate that to the severity or deficiencies of that individual on their impact study when they go and take it again. What we want to be able to do is not only say that they got back to baseline with impact, but concomitantly they also got back to baseline with their blood biomarkers. So sort of to enforce the findings of impact with blood studies. So that's our goal. We're hoping that we're going to be able to have diffusion tensor imaging as well, that MRI imaging that looks at the tracks, as well as a morphological reason to allow for return to play, or as a morphological reason not to let the player play until it's back to normal. At FSU, we have recently created the Center for Brain Repair, which has 3 different parts to it. This is coming out of the College of Medicine. We'll have a basic neuroscience research component, which is the animal work that we do. Next to that, we have a clinical and translational research component, which is to try to push new drug discoveries into human models of brain injury. And then last but not least, we have the education and outreach component. And the education and outreach component is something that's been dear to my heart. Cherie Porter began a traumatic brain injury advocacy blog several years ago, and she asked me to be a part of that team. And we got together several people who had had brain injuries before, from getting run over by cars to being assaulted to being thrown off boats, individuals who have lifelong disability, and some individuals like myself who had a brain injury who was able to get beyond it. And Cherie is going to be the director of this education and outreach, and she's really done a good job. If you go to TMH's website and you go to their TBI advocacy blog, you can really learn a lot about where brain injury research is, where brain injury advocacy is, what are your local areas to go to for information for families and support for brain injury. So I want to talk last but not least about the concussion research. Not to flip back too much, but the concussion research that's going on in my lab now is primarily focused on, as I said earlier, prophylactics or acute treatments after concussion. With our animal model, we do repetitive concussions. We do 3 concussions within a 2-hour period, and they all have a rotational torque to it. An individual to acquire a concussion has to have a rotational component of the head. The head has to rotate. That's what stretches the tracks and actually damages the neuronal axons. Okay, so you have to have a rotational component that goes with it. We reproduce that rotational component in an animal model. We do 3 of them. If I give progesterone 15 minutes before I ever give a concussion, the individual's outcome with regards to memory and attention, the rat's outcome with regards to memory and attention, and anxiety is reduced to normal levels. We're doing this now with vitamin D and with zinc sulfate in hopes that we can actually produce a treatment that an individual could take prior to engaging in high-risk activity, that if they did have a concussion, the outcomes would be minimized. The other thing that we've been able to show recently, if progesterone is given 15 minutes after the last of the 3 concussions, it significantly reduces the poor outcomes with regards to memory and attention loss. Okay, so it's important to think about progesterone. I would never make a male kid take progesterone every day before practice. Okay, but if we can create a progesterone pen that can be given to a kid one time after a concussion on the sidelines, we can significantly improve that player's outcomes. That's the goal. There are no side effects for doing a little progesterone. All right. So this kind of outlines the model that we use for the concussion, but I won't go into great detail. If you guys have questions about it, I'm willing to answer them. This is what it actually looks like. You're looking at the back of the head there and the back of the Sprague-Dawley rat. We've actually done a craniectomy there, and we put a 1 millimeter thick rubber helmet is over the right frontal skull. And the impactor goes down and actually impacts the rubber helmet, producing a downward rotational force. And we do this 3 times in repetition, and then we do indeed create significant memory, attention, decision-making, poor outcomes. So this is to give you a little bit of idea. If you look in the top, you can see the black line coming down, and then you see a green and a red. You can see the black line is way above. Right there. This is a significant difference. The progesterone is in red. No treatment is in black. By day 2 after a concussion, the progesterone is at the same levels as an individual who never had a concussion. That's 15 minutes before, and that's looking right there at memory and attention. That's a memory and attention test. If you look down here on the bottom right, that's a test done for anxiety levels. A lot of patients who develop post-concussion syndrome have severe depression. Anxiety and depression is sort of equivalent in an animal model. So you're looking at a significant decline in depressive behavior in an animal given progesterone just prior to a concussion. So as I mentioned earlier, Cherie Porter is involved in prevention outreach and advocacy, and I'm a member of her TBI blog, which you can check out on TMH's or Tallahassee Memorial Healthcare's website. And I want to give you a little bit of update on some of the new rehabilitation techniques that can be used for individuals who have post-concussion syndrome. Let you know that there is some stuff out there for the rehabilitation, one of which is neuromapping. So you can use quantitative EEG to look at the electrical alterations, changes in electrical activity in your brain. That can be done. Often there is a loss in connectivity between the frontal part of your brain and the temporal part of your brain. When there is a connective loss between the frontal and temporal portions of your brain, you're going to have amnesia type symptoms, memory and attention, poor information and processing speed. So some of the general signs that you see with post-concussion syndrome. Hooked into quantitative EEG, there is new neurofeedback therapies that unfortunately they're a little laborious. It takes about 36 sessions to see significant improvement. It's well worth it to the individual that's part of that miserable minority of post-concussion syndrome patients. Not long-standing, but over the last decade, there has been hyperbaric oxygen therapy that's used for brain injury. You may also know it's been used for wound healing and has been for years. It's shown some improvement in brain-injured patients. We at the College of Medicine, in conjunction with the speech-language pathologist at Tallahassee Memorial Healthcare and the Florida Brain Connection in Tallahassee, I have created a new virtual world cognitive program for concussion patients. And it's pretty cool. There's a lot of memory and attention games that are put into a virtual world while your balance is being challenged in a real world. I think it's always important for us to remember that balance and memory, balance and attention overlap in the brain. Individuals with concussion symptoms will have a will have an increase in their center of mass velocity. What that means is they're more likely to fall. You know, when you're standing up and you wobble back and forth, you've got this natural wobble. Well, a concussed patient does a lot of wobbling. You may not see the concussed patient fall down, but they're much more wobbly than they're supposed to be. So we're trying to improve cognition and balance at the same time. It's important that you remember that an individual is going to have a lot harder time remembering things when they're physically active. Okay? So when somebody asks you to make an important decision, what's the first thing you say? Let me sit down and think about this. Okay? It really does work that way. If an individual is physically active, he's got less capacity for cognitive production, to being efficient cognitively. What we're trying to do is make the concussed patient get that balance, get that activity back at the same time that they're being challenged cognitively. An individual has to be able to think and walk at the same time. The chief function of the body is to carry the brain around. All right. Thanks for having me.